Hello, it's Dr. Wilson. How you guys doing? I'm here today to talk to you about the modified NIH stroke score and how we're going to be using that in the field to help risk stratify our patients to allow us to start using resources in a way more effectively to help treat stroke patients. Um, the modified NIH is sometimes called the FAST NIH, F-A-S-T, the F standing for face, the A standing for arm, the S standing for speech, and the T standing for time. And it's a score that uses a numeric value that's placed upon certain findings for stroke patients to allow us to have a score that will then allow us to think whether or not this patient has a either large vessel occlusion or the need to receive TPA based upon where their stroke score lies. Now the scoring system for face is usually scored from a 0 to 3. For arm, it is scored from 0 to 4, and for speech, it's scored from 0 to 3. And then time, of course, is the time of onset of individual symptoms, so that we can see whether or not they would be a candidate for TPA. The score itself, what we're looking for is a score that's going to be 4 or greater. A person who scores a 4 or greater on the modified NIH, or even on any NIH, is a likely candidate for TPA. If the score is actually 6 or greater, they have a higher likelihood of having a large vessel occlusion, which that means that if a vessel is occluded by a clot, and it is a large vessel, they may be have a benefit to receive interventional therapy. So interventional radiology may come in and actually then retrieve a clot. So let's talk about the scoring system so we can kind of get to the nitty-gritty of what you'll be doing in the field. So first off is looking at the F in FAST, and that's face. And like I said, it's scored from 0 to 3. So 0, of course, would be a normal patient. So such as myself right now, I have no facial asymmetry, no facial droop, and so I'd be scored a 0 at this time. If I was scoring as a 1 would be a person with very mild facial paralysis, such as the nasolabial fold may be slightly off, or the individual may have a little bit of an asymmetrical smile when they actually do smile. So going up the score, score of a 2 for FAST and face is partial paralysis of the face. So it'd be total or near total paralysis of the lower part of the face would be scored as a 2. And a 3 would be complete paralysis of the face, left or right, but the whole side of the face would be paralyzed. So the absence of total facial movement for this patient. So going to the A in FAST, which is the arm score, which is once again scored from 0 to 4. Of course, a 0 would be having normal movement of my arms. If I can hold my arms up 90 degrees or 45 degrees for 10 seconds and they don't move, then I have a 0 score. Now going up the scale, if we score at a 1 would be an individual that can lift their limb up and they actually can hold them up, but during the 10 seconds, they'll start to get drift. The arm won't completely hit the ground, but it'll start to drift at that point, but they can still hold their arms up against gravity. A score of a 2, that individual actually has to have some effort against gravity. So at this point, my arms can be lifted up, but they'll start to drop, and I might need to hold my arm up with another arm to support it because gravity is actually pulling it down. That arm would, of course, drift to the bed, but I can at least lift my arm up against some gravity and make an effort to do so. If I get to a 3, there's no effort against gravity. So I might try and shrug my arm and I can't get it up and can't get my arm up above to any degree at all. And then you may lift my arm up, and as my arm's sitting there against gravity, gravity lets my arm drop immediately. And if you get to a score of a 4, there's complete flaccid paralysis of the extremity. There's no movement at all, no movement against gravity, nothing at all. So when we get to the S in FAST, we're looking at speech. Once again, speech being graded on a 0 to 3 scale. 0, of course, is no aphasia, normal speech. So the way I'm speaking to you now would be considered a 0 on the S for speech. But a 1 will be mild to moderate aphasia. What that means is there may be some slurring of my words, maybe garbling some words. I still could probably name objects if you presented them to me, but there will definitely be some change in the way that I'm actually speaking to you. Maybe even some confusion with the way that I'm answering questions. Um, a score of a 2 is going to be more severe aphasia, definitely having difficulty naming objects if you present them to me. Communication is going to be somewhat staccato in some ways, where I may be really confabulating when I'm speaking to you. And then number 3, of course, by score of 3, I'm a mute. I can't speak at all. There'd be no real response to any kind of questioning that you present to the patient. Um, and then, of course, then the T in FAST is time, and looking at the time of onset of symptoms to say when the last known well was. So the FAST score, if they score a 4 or greater, they're likely to receive TPA, or 6 or greater, they're likely to require interventional therapy. So as you are contacting medical control and letting them know what your FAST score is, we can then start activating our stroke teams, letting them know that we have a stroke patient coming in that has this FAST score, and they can then once again start getting resources mobilized, including the cath lab if necessary, based upon a stroke score of 6 or greater. So it's going to be very instrumental that we get those scores done, that we know the last known well. There'll be other, of course, little nuances that'll be added to the assessment of stroke patients that'll help us to really get these patients risk stratified as rapidly as possible, and hopefully prevent some morbidity and mortality associated with stroke because of our quick and very precise actions taken in the field to assess these patients. So thank you for listening. Hope everything turns out well out there in the field because you guys are doing such a great job. Thank you guys.